Association of Pakistani Physicians of Northern Europe has organized several webinars and education program last year. Today we're going to do our first webinar of year 2024. Thank you to all of you for your patience and listening to us. We have organized different series of webinar this year for the IMG's International Medical Graduates and also local graduates on several educational topics starting from immediate career guidance, interview preparations, and also recent updates regarding the medicine and other specialties of medicine. Today, I'm extremely grateful to my beloved friend, Mr. Mohammad Umair, who is a consultant colorectal surgeon, to come forward and also present this webinar regarding the very important topic. Apne Education team also compiled several series of webinars, including the one and most importantly regarding the learning and training opportunities in Ireland, which we're planning to conduct on 17th of February. We would like you to come forward and involve in educational activities, and feel free to contact our education team or our General Secretary, Dr. Nadeem Sajjad Raja, if you would like to be part of these educational activities. I'm extremely grateful to my team who also helped me in terms of organizing these webinars and other future activities. Without a delay, I would like to hand over to our General Secretary, Dr. Nadeem Sajjad Raja, to say a few words before we start this webinar officially. Thank you.
Thank you very much, Dr. Habib Haider and Dr. Umair for organizing such important webinar. I pay special tribute to Association of Pakistani Physicians of Northern Europe's education team, especially Dr. Habib Haider leading from the front, and they always choose very appropriate topics, very relevant topics for our junior doctors, our middle grade doctors, and our senior doctors. Very helpful webinars, and today's webinar is also very important. And Dr. Umair will take us through the whole journey, how we can become the fellow of a European board. Thank you very much. And I also like to mention Association of Pakistani Physicians of Northern Europe is the largest Pakistani doctors organization. We are a strong voice of our Pakistani doctors. Not only we recognize their success, their achievements, like Dr. Umair, he is our friend, new consultant, and we recognize and acknowledge his success in his field. But so we have got a very dedicated team of senior members who have a vast experience dealing in different matters, so GMC matters, immigration, and even our team provides assistance on financial matters. We have created a special group for advice to junior doctors. If any of our member is facing any difficulty or they need guidance, support from Association of Pakistani Physicians of Northern Europe, so they can email us on advice@appne.uk. Thank you very much, Habib, Dr. Habib Haider and Dr. Umair for this such a lovely webinar. So I like to make 3 announcements. Dr. Habib Haider already mentioned, so webinar on 17th of February, please do register yourself and join that webinar. That is very important on 17th of February, 2 o'clock in the afternoon. Our annual function and gala dinner is on 31st of August. So we will release tickets very soon. So please keep an eye, and that would be very lovely annual function at International Convention Center, Birmingham on 31st of August. And our education team, under the supervision of Dr. Habib Badar, they are going to organize one-day educational event on 28th of September in Walsall Manor Hospital in Walsall. So I hand over mic to Dr. Habib Badar. Thank you very much, both.
Thank you, Rasa, once again for your excellent words and the brief introduction regarding certain things. Now, everyone, we come to a point to say thank you to our colleague and esteemed speaker, Mr. Muhammad Umair. He is a general and colorectal surgeon, executive member, and director of communication, European General Surgery Bureau. During the webinar, we would like to cover the eligibility process, certification, and various resources for undertaking the pathway to success and become a fellow. Thank you once again, Umair, to come forward and to guide us regarding your knowledge and your input. Thank you. Over to you.
Thank you very much, Dr. Habib. I'm just going to share my slides with you. As Dr. Habib kindly said, I am one of the general surgeons and general and colorectal surgeons in Ireland, and currently working as Director of Communications with the European Board of General Surgery. Today's webinar, we will be highlighting how to become a fellow of the European Board of General Surgery. And what does UEMS?
Umair, sorry, one thing. Just sorry, guys, to interrupt you. Sorry, just ground rule. If you guys have any question, please ask in the chat box. We will answer at the end of presentation. Thank you. Sorry.
Thanks very much. So today's webinar, we're going to talk about how to become a fellow of the European Board of General Surgery and what it entails for all of us. European Board of General Surgery, the UEMS, what does UEMS do? UEMS is an organization which deals with the section of surgery itself and sets or recommends the standards of surgical training and practices. It broadly categorizes itself into conducting high-level surgical specialty examinations, European training requirements, surgical training accreditation of training centers, and also supporting the CMEs in surgery. Currently, within the European training requirements, there are three subspecialties which have been developed and recognized over the last while, transplant surgery being the first one in 2018, subsequently general surgery, and also endocrine surgery in 2022. Surgical specialty examinations are conducted and organized under the umbrella of UEMS, and they are at present in 12 different subspecialties. Apart from this, UEMS has recently started conducting online webinars, and you can scan the code there on the presentation slides and visit their page for informative webinars in different subspecialties of surgery. Fellows of the European Board of General Surgery, or fellows of the European Board in general in different subspecialties. The fellowship examination is an indicator for professional competence and excellence. It actually reflects the European standardization, harmonization, and the quality assurance process in medicine. Just to introduce our executive board, the president of UEMS and the president of Division of General Surgery is Professor Paul Ridgway, and he's also the chair of the examination committee. Overall, the UEMS is governed by Professor Daniel Casanova, and the president of the Board of Surgery is Arthur Felici. The Division of General Surgery was initially established in 2015 And since then, it has been delivering and conducting the general surgery examinations across different countries. And the successful candidates are allowed to add in the title of Fellows of the European Board of General Surgery. The EBSQ General Surgery Examination is an exit examination, and it constitutes the final rite of passage for specialist trainees in general surgeries who have satisfied the requirements set by the division or the bureau according to its syllabus and curriculum. The important facts here to keep in note is, once you become a fellow, it does not lead to an automatic recognition for specialist registration in the European countries. We will be touching into that in a little while, but it does not give you a right to practice in any of the UEMS countries straight away. Saying that, some countries do, once the trainees have completed their relevant training programs or alternate training programs and satisfied all the requirements of their relevant curriculum in their countries, FEBS may lead to eligibility for the CCT, which is the completion of training. Now, if you have any doubts in terms of what this qualification holds for you, I would encourage you that you must clarify it with the regulatory body of the country that you are either practicing or you intend to practice. Now, the next examination is in Brussels on the 11th to the 13th of September this year, and the application deadline are up till 31st of May 2024. You can follow the reference link here to go through the application process. We will talk about more on how to get the eligibility process done, what it entails, what the examination is all about, and how best prepare yourself to go through this at the end of the day. Now, there are a few important documents that I would encourage all of you to go through meticulously. The first one being the syllabus, which is what the course information is. It defines the expectations and the responsibility of a fellow and what you need to know. And it also helps you in preparation for your examination. The curriculum is based on the syllabus, and it introduces a new concept, which is called an EPA, or Entrustable Professional Activity, and guides you through a competence-based unit for the examination process. It outlines the objectives, the academic content, and the methodologies to be adopted during your training to achieve your aims and to achieve the fellowship. The syllabus and the curriculum, it highlights certain topics. Now, I would encourage you to focus on these topics while preparing for your examinations as well. There are certain core topics, including the general aspects of general surgery, abdominal, general surgeries, trauma and emergency, vascular and breast, and endocrine. Then there are certain elements that, as a general surgeon, you should be aware of, which includes the subspecialties of urology, transplant, and pediatrics, and so on. And these, even though you do not need to know in significant amount of detail as would a urologist or a transplant surgeon would need to know, but you need to know them enough to manage certain general surgical aspect of your training. I would encourage you guys to have a detailed look at these when it comes to preparation. The FEBS in general is a two-step process. So the quality and validation process entails, the first is the eligibility, and the second is the examination. After that, once you successfully complete your examination, you are allowed to use the title of a Fellow of the European Board of General Surgery. We will highlight different aspects for both these, both validation processes in detail now. The eligibility requirements, they entail 10 documents that you would need to submit to achieve the eligibility process. Now, making it easier, 5 of these documents are very simple. They are downloadable. There are templates available, and all you need to do is fill them and submit them online. And there is a reference link at the end of the presentation that you can use to access these documents. These documents include the application form, the surgical evidence of competence logbook that needs to be signed, your CV, most up to date, 2 reference letters signed by your trainers, and there is a declaration or a commitment to abide by the assessment regulation. This is in general how it looks like. So on the far right corner, you can see an application form. You have to fill that in a Word document. Then it looks at the reference forms that you need to submit. And subsequently, there is your CV, a template for your CV. All these forms and templates, they are available on our website. You can visit them and download them, fill them in. So that clears out 5 out of 10 of those documents that you need to submit. Just going into some bit of details of the competence-based logbook that you have to submit. A lot of the questions that come to us while candidates are filling in these logbooks is the ambiguity that they feel while filling it in. It is EPA-based, and EPAs that are considered compulsory are marked in bold red type. These competencies are expected to be a level 5, which means that you can be entrusted by your trainer or your supervisor to perform this and as unsupervised, independent, and you're eligible to perform it as a day 1 consultant. Then there are certain EPAs that are considered desirable, but they're not compulsory for achieving the eligibility of your exam process. They are marked in green and italics. The trainee is not only capable of tackling the particular procedure, they should be independently, but they should be entrusted to perform that by their trainers is what we are looking for. This is what your logbook will look like. And in a nutshell, you can see there is elective hernia repair, open and laparoscopic. Certain of these procedures are marked as bold and red, but there are certain procedures in upper GI surgery that are marked in green or italics. These are desirable, but they don't have to be necessarily as part of your training process, depending upon the country of your practice at present. Now, going on to the other aspects of your eligibility. So we've discussed about 5 templates that are already there on the website, easy to fill and submit online. There are 5 more criteria that you have to achieve. And one of them is credit points or the CME points. In particular, you need a total of 25 points. These 25 points can be built up from any of these particular areas. So your participation in international congresses, your participation in with presentation in these international conferences or national conferences, and also your publications in both national and international journals. All these points are laid out for you in the guidance document, and all you need is a cumulative of 25 points for your eligibility process. Now, let's see what you need in terms of eligibility as a whole. So that includes your application form, your CV, a certificate of your primary medical qualification with an evidence of 6 years of your surgical training, your medical registration certificate, a proof of your identity, the surgical logbook template as provided in the previous slides, evidence of 25 credit points in CME or publications, 2 reference forms signed by your trainers as per the template, and the eligibility processing fee. Now, once you have all these documents, you have to submit them in an online application form. At the time of submission, the total fee of the examination is 1,200 euros. But at the time of submission, you have to submit in eligibility fee, which is 450 euros. And later, once the eligibility process has been completed, you will be asked to pay the examination fee, which includes 750 euros. Now, recently, in the last few years, we have what we call a gold certificate, which is for the first place candidate in each session of the ESPQ examination, and they are awarded a stipend of 1,000 euros. Now, those people who are applying for the examination and are currently from countries which are in the least developed countries list of the United Nations, these candidates who are successful, they will each have 1,000 euros subsidiary or a scholarship, international scholarship available for them. And this is available as well. The next document I would want each and every one of you to take a very good look is the blueprint of the examination. This basically highlights the contents of your exam, and it tells you different aspects of the core topics that will be there for the examination and what your examination or how much your examination would be based on each specific one. For example, your general aspects of surgery would constitute the maximum percentage of your examination, which includes 25%. And subsequently, the general surgery in subspecialty interests, the things that we talked about like urology, pediatrics, and neurosurgery, they would constitute only 10% of your examination. So this is a very, very important point here in terms of your preparation for the exam as well, that it highlights how you will be able to prepare best for your examination going forward and what areas to concentrate on. Now, when we look at the sample questions, the part 1 constitute the MCQ part of the examination. It is a single best MCQ. There is no negative marking for these questions. So we are encouraged to tell you that you need to attempt all questions with a single best answer, keeping in mind. And there are sample questions that are available on our website that you can reference to on what the question will look like, how it will be phrased. And as I said, it is based on single best answers and no negative marking. So we encourage you to attend all questions. Part 2 of the examination is based on the oral or OSCE examination, which is essentially based on ACE clinical examinations. These are task-specific checklists, and you will be asked certain questions over a period of time, and each relevant section of that question would be weighted according to their clinical relevance. So not necessarily that if you're asked a question and the first question occurred on that scenario is a bit basic, that might not be the case that it is weighted equally to a question where you are acknowledged on your knowledge and skills as a clinician to work independently as entrusted and are at a nodal point of your transition to a day 1 consultant. So there are task-specific checklists as per the examiner. These are weighted according to their clinical relevance. And then there is a global rater at the end. And the mark sheets, they're all standardized. Now, how to best prepare for the UEMS general surgery examination? This is a very, very common question that comes across to us over a period of time. And a lot of the candidates face difficulty in going through the examination process of preparation. I would like to highlight top 10 tips that helped me get through certain fellowship examinations. Now, the first thing and the most important thing is to understand the exam format. So we know now it's going to be a two-part process, with the part one being the MCQ, which has single best questions. There is no negative marking. You should attempt all questions. And part two will be based on clinical scenarios on the ACE examination. Now, I would encourage each and every one of you to read the curriculum or the syllabus very thoroughly. Look at the blueprint. Blueprint will guide you according to what percentage of questions in your part one will be from different aspects of surgery. So prepare yourself and spend most time on those things that have the highest percentage of questions and also your weak areas. Now, create a detailed study plan for yourself so that you can focus on the blueprint as best as you can. Use official resources. Again, I would say use the guidelines, syllabus, and the curriculum religiously. Practice time management, which is crucial for any exam. Do mock examination and self-assessment. And then this will help you to identify your strengths and weaknesses over a period of time. And you can concentrate and revisit those areas that you considered you need more time on. Stay up to date with current guidelines in general surgery, as general surgery is a very dynamic field and things change so rapidly. You need to be well prepared for that. Join study groups, contact and collaborate with fellows and your colleagues to go through the examination. Focus on your weak areas, identify them, devote extra time for these areas, and also review and revise regularly over a period of time, and schedule your periodic reviews prior to your examination. Don't go in without a review. Now, out of all these, most important thing is take care of yourself. So the last thing I would say is make sure you take regular breaks, have good nourishment, and take your time and concentrate on your studies along with looking after yourself. Now, there are tons and tons of resources out there for all the fellowship examinations, including the FRCS examinations, the European Board examinations. You can use BMJ, PASS test, EFRCS. One important thing is don't go reinventing the wheel. Concentrate on the syllabus, the blueprints, and pick your resource material wisely and use them and revise and concentrate on your weak areas and redo them. Now, how do we score these examinations and what you need to do to be eligible to pass an FEBS? You have to complete and pass both part one and part two. Part one is scored at the 75th percentile, 75th percent of the 95th percentile of the score. And it represents 40% of your overall marks. So your MCQ represents 40% of your overall grading. The rest of the 60% is contributed by your part two examination. And in the part two examination, you are assessed on the competencies of a surgeon in autonomous practice. The most important thing is there is no compensation of marks between these two parts. and you will be given the final comprehensive results after your part 2 OSCE circuit is complete. So you will do part 1 on one day, and then you'll do the part 2 on the second day, and all candidates will be doing part 1 and part 2, and at the end of part 2 you will be given your comprehensive final results, and hopefully that will be a pass and you will achieve the FEBS. If you have any queries, you can get in touch with the UEMS General Surgery office on these details, and you can visit their website. You can send us an email and we will help you through the process of whether it's eligibility or if you have any questions in terms of the examination. Now, I would like to thank Dr. Habib and Dr. Nadeem Raja and the whole team of APNE and their educational team for giving me this opportunity to present to all of you on this important topic. And we will be open to any further questions if you have any. Thank you very much.
Excellent. Thank you so much, Umair, for such a nice and excellent presentation. I must say that you actually really did very well, and I think it's like a what you can say, it's a sadka jariya that when you try to help others, the God always try to help themselves. So I think thank you so much. Well done. Excellent presentation. So I think the best thing is that in the presentation you said about the top tips for examination. I think these are the tips not only for surgery examination. These tips are valid for any examination. So I think that these are the main core principle that everybody should need to follow if they need to give any exam, including fellowship exam or any membership exam. So I think that we have some question. I think in terms of chat box wise, there is a question from Zishan, who's asking on behalf of his colleague that what is the current take of GMC and IMC on FEBS exam, which Fellowship of European Board of Surgery exam, as eligibility for a special registration in general surgery.
So I think I'll, as I said earlier in the presentation, that FEBS alone, and especially FEBS general surgery alone itself, that does not qualify you to achieve specialist registration in general surgery. And if you look at IMC and GMC specifically, both IMC and GMC have FRCS as their standard exit examination. And FRCS has two parts, including the general surgery and subspecialty interest. So the FEBS, even though the general surgical part is there, the subspecialty interest part is not there. So it does not automatically gives you the right to to specialist registration in these countries as of yet. But as a group, UEMS division of Bureau of General Surgery is working very hard for its accreditation and recognition in the near future.
Okay, thank you so much. I hope that Dishan, you got the answer for your question. And if you still have some question, you can write down on the chat box. In terms of regarding, some people send me the message regarding some questions. So I will start with regarding in terms of fee structure of examination. Can you please tell us about this fee structure and how it's going to work?
Yes, so the fee structure is the total fees is about 1,200 euros. But you don't have to submit 1,200 euros straight away when you're applying for the examination. So it is being split into two. The first process is your eligibility process, where the fee structure is 450 euros for the eligibility. And once you're deemed eligible for that, then you have to submit the fees for the exam, which is another 750 euros. So you don't have to submit the whole 1,200 in one go. It is being divided into the eligibility fee separately and the exam fee separate.
So we can pay in terms of like installment wise.
Kind of, yes, yeah. So your 450 first, and then your 700 for the exam afterwards once you're deemed eligible for the exam.
So is there any specific criteria, like in terms of people from developed countries going to pay less, or people in the Western world can pay, like in terms of their different rates like this?
So in terms of that, in the last few years, what we've started is what we call a EBSQ International Fellowship Scholarship. And this allows candidates from the list of least developed countries on the UN list to apply for the examination. And what they will get is €1,000 for the scholarship, which is a significant subsidy for the exam.
Okay. And in terms of recommendation, who can sign the recommendation letters, especially for those applying outside EU?
So the recommendation letters or the reference letters, there is a very specific guidelines in the reference documents. The first referee is supposed to be your clinical trainer, head of department or a clinical director of the hospital. And your second referee can be a consultant surgeon or equivalent who you have worked with. So you need two reference letters, and the first reference is from your clinical trainer at present or head of department or the clinical director, and the second one can be a consultant surgeon in practice who you have worked with.
Do they need to have fellowship of European Board of Surgery?
No, that is not necessary. So any trainer that you are working with at present, who is head of department or a clinical director of your institution, can sign as a referee one, and the second can be a consultant surgeon. So they don't necessarily have to be FEBS or a fellow of the European board.
Okay.
Because that kind of limits the possibilities of people applying from international countries, including Pakistan, down the line, and it becomes difficult for them to apply for the exam. So it's not a requirement that they have to be FEBS.
So on this note, I think someone asked this question that especially in terms of countries outside the UK and Ireland, the endoscopies are usually not performed primarily by surgeon. So how does this reflect on the eligibility process of those applicants?
So it's a very good question, because our logbook specifies certain endoscopic procedures as well. So as I mentioned in the logbook template that you will be provided on the website, there are certain aspects that are marked in bold red, which means that those entrustable professional activities or EPAs, they are compulsory for eligibility process. So these are those general surgical procedures like hernias and fissures and fistulas or abscesses and things like that. But then there are certain aspects that are marked in green italics. These are procedures that may require some subspecialty interests. So they are marked in green italics, and most of the endoscopic procedures are marked in green italics, and they're not compulsory, because we're aware and that in certain European countries and international countries, most of the endoscopies are dedicated to gastroenterologists, and they might not be performed by general surgeons, unlike UK and Ireland. As you would be aware of, in UK and Ireland, most of these things, the endoscopies are performed both by general surgeons and by gastroenterologists. But in certain European and international countries, there is a distinct separation of these procedures. So the endoscopic procedures, most of them are green italics, and they're not compulsory. And if you have certain expertise in them, that's fair enough. But if not, then most of the red bold ones, bold EPAs, should be performed by a person who is going for the FEBS general surgery exam.
Thank you so much. I think we have a question from our guest from Dubai, Ramesh Kumar. First of all, Ramesh, thank you for understanding because you joined earlier regarding the pre-webinar meeting and you kindly managed to understand and then left that meeting and come and join us again for the webinar. So thank you so much. So his question to you, Umair, is regarding, is there any limit of attempts for the exam?
All these limits and things are explained in the FAQ section on the website. So if you visit our website, you'll find the FAQ section over there, and that will explain to you how much attempts there are and what you can do in terms of how many times you can redo. Yes, but yes, there is. You can resit the exam if you don't pass the exam for the first time.
Umair, can you please share the link on the chat box so people can actually have access? Is that okay with you?
Yes, yeah.
Thank you. In terms of other question, I think somebody asked for, can you highlight the key points in grading system?
So the grading system itself is constituting of two parts as per the examination. There is part one, which is the MCQ exam, and the part two is the clinical or the OSCE exam, which is based on the ACE pattern. And the MCQ is 40% of your overall marks, and it is graded as the 75th percent of the 95th centile of the highest mark. And number two, part two is essentially an OSCE examination, which is based on ACE evaluation, and you have to achieve competency as a person or a surgeon in autonomous practice. Now, this year, both part one and part two, you will appear in both part one and part two together. 1 day for part one, second day for part two, and you'll run through the whole exam, and your result will be declared after part two is complete on day 3. And you need to achieve pass in both part one and part two to be able to achieve the FEBS.
Okay. Any other question, guys? Thank you once again, Umair, for answering all those questions. There's a question from Muhammad Ali Safdar. Thank you, Safdar, for joining us today. In which country this fellowship is accepted as a specialist or a consultant qualification or a grade in terms of your base?
So I can tell you, for example, within the Europe, Malta accepts this, but the trainees have to have completed their relevant training program, satisfied all the requirements of their curriculum, and they can sit for the FEBS as a CCT. Pakistan accepts this. PMDC accepts FEBS as an exit examination. Certain countries in Middle East, they recognize FEBS as an exit exam. I'm not sure about what their standing is on allowing you onto the specialist register based on the FEBS, but they do accept FEBS as an exit exam in certain Middle Eastern, Pakistan, Malta, and these countries. But I would again strongly suggest that if you are intending to apply to a certain country, you should definitely get in touch with their medical council or their relevant training body and go through the process of asking them individually at your individual level. It does not just automatically allows you to get onto the specialist register, because there is a significant amount of paperwork that you might be aware of that is there to achieve a specialist registration, especially in the UK and Ireland and other European countries would have similar pathways. And you have to achieve a certain level of competencies to achieve that. An exit examination just is one single part of it.
So does it mean the people who can have this FEBS fellowship of European Board of Surgery, they don't get automatically the grade of a specialist registrar in terms of consultant level post in UK.
Not automatically, no. No,
Okay,
they'll
so you
have to
just
go through the Caesar path. Exactly, they'll have to apply through the Caesar pathway, fulfill all the rotations and everything else. It's not just simply FEPS general surgery allows them to get onto the specialist registry.
What about the countries like Middle East? If somebody can have this fellowship in European Board of Surgery, can they not go into Middle East or other countries like India and Pakistan and
It
apply for a
does give them an
consultant?
edge. Yeah, it does give them an edge, and I know a lot of certain colleagues who have went back to Pakistan and they have FEPS general surgery and they've started working there.
Okay, fine. Any other question, guys? We are going to wrap up the webinar very soon. Once again, thank you everybody for joining us today. I'll give a few more minutes to guys. Meanwhile, I'm going to just ask Mr. Omer to give us a take-home message, or is there any key point which you think that regarding this fellowship exam board of surgery that you're going to highlight at the end before we're going to wrap up?
So I think, as Dr. Veeb kindly said earlier, we discussed a few key tips and tricks for the examination, and I think those tips and tricks of the exam applies to any fellowship examination as a whole, whether it's general surgery, FEBS, or FRCS, or emergency medicine, internal medicine. I think those would involve for any examination as a whole. But overall, I would say do not try to reinvent the wheel. Concentrate on the resources, books, and materials that you use on a regular basis. Work through the syllabus and blueprint, and make sure that you cover all those topics and go for the exam.
Final question from the Zishan. What is the extra benefit of FEBS, Fellowship of European Board of Surgery, for someone who already has their exit FRCS?
So I think those people who already have an exit FRCS, I don't think that FEBS gives them any extra advantage apart from having another additional degree, whether it's in general surgery or any other subspecialty. But it's individual preferences, and most of the people who go for the exit FRCS do the FEBS general surgery before the exit FRCS, so kind of gives them a good run through the exam process and also a very competitive exam to go through.
So on this note, Omer, my question to you, as you know that nowadays they're developing new pathways for Caesar trainees, and all the hospitals and most of the trusts have that Caesar lead. If you guys have this fellowship of European Board of Surgery, do you guys have any plan in your trust, or have you seen come across this experience in other trusts that they have separate lead? Like Alhamdulillah, you are doing very well in terms of like director of board of communication from European Board of Surgery. So was there you can achieve something in your post, have for in terms of like PA, or get any benefit in your career, either financial or non-financial in terms of academic perspective after having this extra degree?
So we're working at the moment very closely with the Royal College, and we're trying to achieve certain things, and also a generalized accreditation of the FEBS across the European countries. So it is in the pipeline, but at present, currently UEMS, as I said, runs CME accreditations and webinars and accreditations of certain training institutions as a whole. So that can be one beneficial thing for individual trusts to look forward to at present. But overall, we're working closely to get this exam excelling and up and accredited in CSER pathways.
Good. Excellent. No, thank you so much. I think you answered my question very well. And once again, thank you everyone for joining us today. On this note, I'm going to wrap up the webinar. Please remember these 3 dates. First of all, 17th of February, when we're going to do another exciting webinar on learning and training opportunities in Ireland. Second date is 31st of August is APNE, Association of Pakistani Physicians of Northern Europe, will celebrate their annual gala dinner with musical night and lots of other activities on 31st of August. And then APNE education team going to plan another exciting and informative day of educational activities on 28th of September. Please feel free to join us in educational activities and come forward and write down to the email apne.education@gmail.com. So once again, thank you everyone for joining and looking forward to see you guys soon for another webinar. And thank you once again, Mr. Omer, for giving their valuable input. Thank you everyone. Take care.
Thank you so much, Dr. Habib. And you guys are more than welcome to contact us at any time if you have any further questions or queries. Thank you.
Thank you, Matt. Okay. Thank you guys.